My day actually really varies according to what happens at work, and I think that's the beauty of it. So no day's exactly the same, and I don't really know what my day will be like a lot of the time, which can be, I guess, terrifying initially, but quite exciting as well. You never get bored. I do consider myself quite lucky to be a Western Sydney graduate. I had no idea what to expect when I started because it was a new course. We didn't know anything about it, and whether it would be good or not, we weren't too sure. But I think it's an excellent course. I think it's made me the person I am today, and I think it actually really helped me get onto surgical training. And I've got memories of staying back as a medical student, scrubbed in theatre, operating on major operations up till late at night, just because we were interested, and the surgeons involved were really keen to teach us. So really a lot of fond memories, and that has really, I guess, shaped the way that I practice and work today. The Western Sydney University degree, they do a few things to help prepare you for surgical specialty training or any other specialty training later down the track. So they're quite focused on being in hospital and clinical-based learning. So from the first year, every second week you'll have tutorials in hospital, and then that becomes full-time for about third year onwards, which really helps. You also have a lot of anatomy-based dissection classes, which again are quite useful, and the lectures as well that they give, they'll have different themes, etc., which help give you a broad variety of teaching in the scope of medicine. I think that being part of Western Sydney University really has opened up my eyes to, I guess, what the greater portion of Sydney is like, and how there really is diverse cultural background and socioeconomic status. You meet people from all walks of life, and I do think that that has made me better able to relate to the average person and focus more on my work. So I think what differentiates Western Sydney graduates is we really do have a sense of community when we see each other. There's a sense of belonging. We all get along. We all came, I guess, from that group, especially the first year. I think we've got a bond there that we'll always have, and I think that'll probably help us in our practice later down the track as well, when we can refer patients to each other. I can't believe how quickly time has gone. I'm currently exactly halfway through my general surgical training, so it's actually been about 10 years since I started medicine in terms of university, and now my postgraduate training. It is really hard. I can't say that it's easy, but I think it's worth it if you're in it for the right reasons. I think it's a really rewarding career as well. I don't think many other careers give quite the same rewarding experience as medicine does, to actually truly be able to help people. I think it's something that's really worthwhile doing.